Good evening, dear friends. I am Dr. Arun, consultant gastroenterologist and hepatologist. Today I have chosen a very interesting topic and also a very important topic to discuss with you all. Few days before, a middle-aged woman, aged around almost 30 to 35 years, who presented to me with complaints of mild abdominal discomfort, which means she had mild stomach upset. And this problem was there for the past 4 months to her, for which she underwent multiple treatment elsewhere outside. When I examined her, only one positive finding I noticed on her, which means what was the finding is she had easy fatigability, which means whenever she tried to do any work, she felt very tired. It shows a very clear pointer that blood count is low, which means hemoglobin is low. She looks to be anemic. Her hemoglobin was around only 8. Normal hemoglobin in a female should be more than 12 approximately. In case if you are going to land up with low hemoglobin, which shows a very clear pointer that this problem is not only because of mild gastric upset, it would be something more than that, which made a very clear pointer for me to suspect, and I did an endoscopy to her, which clearly showed a very big cancer in the entire stomach. She is not an alcoholic. She is not having any bad habits, no smoker, no other risk factors. She had only mild discomfort. For this kind of problem, she presented and she proven to be a dangerous stomach cancer. What are the various symptoms you may get? You may feel easy fatigability, which means you may have early tiredness because of your loss of blood, and you may have abdominal pain. That is one of the characteristic presentation, which is predominantly in your upper tummy areas. Next to that, you may feel any lump, which means any swelling in your upper tummy. You may also notice some sort of swelling even in your neck or even in your shoulder areas. Next to that, you may have stale food vomiting. What do you mean by stale food vomiting? In case if you are going to consume your food by 8 a.m. in the morning, and if you are going to develop vomit by around 2 p.m. in the afternoon, which means your food particles remains undigested in your stomach for more than 6 hours. So if this kind of presentation happens, there is high pointer for you to think in terms of a stomach cancer. And some patients may also develop a ball rolling movements in your upper tummy. In case if you are, suppose if you are going to play with a ball from this side to that side of your tummy, you can able to feel the movement. So that kind of presentation also may report if you are going to land up with this kind of gastric malignancy. Always you should remember that if in case if you are going to develop any of these complications, report to the gastroenterologist immediately, because early stomach cancer, if you are going to intervene in a right way, you can able to remove that cancer easily through an endoscopic modality itself without much of surgical interventions. There are so much of treatment advance has been happened in this field of gastric malignancy to overcome all the complications successfully. Thanking you all for patient listening.